Hello, I'm Katoya.
Nice to meet you. I'm Tisa.
Hi, Tisa. Nice to meet you. So before we start, I just want to let you know that anything that you say stays between us unless you want to harm yourself or harm others.
Okay.
Okay. So we're bringing you in today.
I don't know. I don't really feel like I need to be here, but I don't have anywhere to go. So they told me to come in here and talk to somebody.
Why don't you have anywhere to go?
Well, I used to stay with my grandma, but I ran away because I just didn't live with her no more. So I need somewhere to stay, I guess. I don't have anything, so I usually have to figure out how I'm going to eat and stuff like that. So
Okay. So how old are you?
18.
Okay. Where are your parents? If you don't mind me asking.
Well, my mom's dead. My dad murdered her about 5 years ago, so he's in jail. That's why I was with my grandma, but I didn't want to stay with her anymore. So
So did you run away or?
yeah, I ran away. I just didn't want to be there.
Okay. So what's your plan right now?
Right now, it's just figuring out how to get through like my day to day since I don't have anywhere to go or like a job or anything.
Okay. So what do you like to do?
Usually, I'll just hang around people I meet around town, and we'll do some drugs sometimes. Sometimes I'll have sex with someone for some money so I can eat, but that's really it.
Okay. So there's substance abuse issues?
Yeah,
Any mental health issues?
not to my knowledge.
Okay. So is the substance abuse issue something that you want to correct?
I guess I'm more concerned about finding somewhere to live.
Okay.
So I don't really want to have to do what I do.
So you don't have any other family?
No.
Okay. And you said you don't want to do what you do. What do you do?
So, well, like I said before, I don't have anywhere to go and I don't have a job or anything. So I usually, like, I've had sex with men a couple times just for a couple dollars so I can eat, but that's really about it. And I don't want to do that anymore. So,
Okay. So just to put everything into perspective, you ran away from your grandmother's house. Your mom is no longer living. I do apologize about that. Sorry for your loss. And your father is in jail.
mm-hmm.
Do you communicate with him?
No, he sent me a letter a couple days ago, or maybe a couple weeks ago. He wants to talk and like apologize about what happened since it happened right in front of me, but I don't really know where I'm at with that.
Okay. Take your time. You don't have to talk to him if you don't want to. So have you talked to anybody as far as like therapists or anybody in regards to what you've seen?
No, I don't. I'm not really familiar with how like therapy or anything like that works, but I guess my main concern is having somewhere to go and a means to getting something to eat every day to take care of myself.
Okay, understandable. So I'm a youth case manager, and what we do here is we help you get back on your feet, whatever that looks like to you. Um, I can help you apply for food stamps. Do you have food stamps?
No, no.
Are you familiar with what that is?
No, what is that?
Okay, so food stamps is it's ran by the state, and basically you get a card and you get to go eat. Swipe and go eat.
So is it like money?
Yes, but no, because you can only purchase food with it.
Okay.
So I'm gonna help you apply for food stamps. Have you ever had a job?
No.
Do you want to work?
I guess I don't really know where I could go though.
Okay. So what kind of things do you like to do? Do you see yourself doing?
I don't know. I like shopping when I have money, so maybe like retail.
Okay. Right now there's a lot of retail jobs hiring, so we can look into that. We can also look into like a kind of like a work study program, but you don't go to school. Do you have your high school diploma?
Yeah.
Okay, great. Well, you kind of get paid for learning skills that will help you with your job. before you start the job. Have you heard of that? Any of those programs before?
No, so like, what do? You work and
They basically teach you, like, if you're going to Ross, they'll teach you how to fold clothes and like hang stuff and teach you to register, but you're not employed with them yet. It's like a 2 week to a month program, but they still pay you, but it's just not full time pay.
Okay, so like
Just to get some job skills under your belt.
Okay.
So I can help you apply for food stamps. We can help you get some job skills. And have you heard of CBI?
No.
Okay, so CBI I feel will be really good for you. It's kind of like just someone to talk to when you need it. There are people that have been through what you've been through, so they're just there to help you navigate through the system if you're interested in that.
Maybe. So is it just like therapy, like group therapy or something?
It could be anything you want. Honestly, it could be one-on-one. It could be group. It's up to you. Or you can even go to workshops if you like. So all depends on what you want. No, everything's totally up to you.
Okay.
So do you have any other support besides your grandma, your parents? Do you have any siblings?
No, it's just me and my grandma right now. And my dad in prison, but that's really it.
Okay. So does your grandma know where you are right now?
No, I don't really like talking to her.
Okay. Understandable. So what are some ways that you think that will help you in your situation now? Like, what can you do?
I don't know. It kind of gets hard, like, when I'm coming down, when I am, using, it's fine when I'm doing it, but like coming down and then realizing I don't have anywhere to go, and then what I have to do so I can eat or get more drugs. It's just, I think that maybe working on not doing as many drugs as I usually do might help. That way, whatever money I do get doesn't have to go towards that.
Have you ever thought about a rehab program?
Yeah, but doesn't that cost money?
Well, after I help you apply for access, which is insurance through the state, they will pay for it.
They would pay for it.
Yes, they will pay for a rehab program, only if you're willing to go.
I guess I could go.
Okay.
Will I have somewhere to stay?
Yes. So the rehab program, how it works, there's different ones. There's one for youth where it's like a big house and a therapist lives there and a rehab specialist, and you have your own room.
That sounds nice. And they give you food and stuff?
Yes, it's a 60-day program.
What happens after that?
After that, it's totally up to you. You can either stay or you can leave.
How long can I stay there? Like just the 60 days?
No, 90 days. The 30 is 30 additional days.
So do you like help me get a job after or during?
If you like, yes, we can. After you complete the program, I can help you get a job.
But I have to do the program first?
No, you don't have to do anything. It's totally up to you. But I know you said that you wanted to, try to stop using as many drugs, so I think that program would be great for you.
So, like, what do you do? Are you the person I would talk to?
No, I'm a social worker. So I just support you through this journey. Whether it's looking for a job, finding housing, getting off drugs, getting off the streets, whatever you need help with, that's what I'm here for. Just the extra push along the way.
Okay, and are you always here, or?
Well, I'm going to give you my cell phone number, but I only work Monday through Fridays. On weekends, I do not answer my phones.
Okay, that doesn't sound too bad. Well, what do you think I should do about not having anywhere to go right now? Could you help me find somewhere to go?
So, yes, I can help you find a shelter to stay in, or do you want to go to a rehab program?
I don't know. Am I allowed to leave?
So, no, it's an inpatient program. You won't be able to leave if you commit to it.
And shelters, aren't they like dirty, or are they safe?
They do have security guards. They have case managers there. They have people to watch you. They have a metal detector there. So I think it's pretty safe. As far as dirty, To each his own, honestly. I'm not going to lie to you.
Okay. I mean, that doesn't sound too terrible. I guess anything is better than what I have now. I mean, as far as like therapy and counseling and stuff, do you think I should talk to my dad, or what do you think?
Honestly, that's your decision. Whatever makes you happy at the end of the day. If you feel like it will benefit you, then why not? If you don't, then you don't have to.
Mm, I'm just not really sure.
Or you can just wait till you're ready.
Okay. So since I'm 18, you guys don't have to tell my grandma or anything, do you?
No, like I told you earlier, anything we discussed stays between us. Unless you say you want to harm her or you want to harm yourself.
Interesting.
So what we're going to do right now, we're going to make a case plan. And what this is, if you decide to go into the shelter, or even if you don't, you decide to go to rehab, we're going to meet once every 2 weeks to see your progress or to see if you need any more resources. So right now, with this case plan, we're going to start off with getting food stamps, applying for food stamps, and then we're going to apply for access. After you apply for access, you can go into rehab. But like I said, that's up to you. You don't have to.
So is access like healthcare?
Yes, access is health insurance. But right now, the number one priority is just to get you off the streets and have a roof over your head. So I'm going to get you into a shelter. It's called Cass Homeless Shelter. I'm going to get you in there. And then there, you can apply for food stamps access, and they come the same day.
The same day?
The same day. And you can go to McDonald's, Jack in the Box. You can go to a lot of places to eat there. And then after that, that's where we chose. Do you want to stay in Cass and work the program, or do you want to go to rehab?
Okay. Do I have to decide right now?
You don't. It's totally up to you. You have time. And we can also start searching for retail jobs. But, one day at a time. Let's just get you in shelter first.
I like that.
Okay.
So with this access, can I go to the doctor whenever I want to? Or, like, how does that work?
You can go to the doctor whenever you want. With access, on their website, or I don't know if they can give you a list, but I can check for you, or I can print out a list of doctors in your area, and we can go through them together, and you just call one and see if they have any open availability for new patients. Go from there.
Okay, I think I'd like that. And you said what is the place called? Cass?
Yes, Cass Homeless Shelter. I'm gonna actually give you a bus pass to get there.
Nice.
Yes. So, yeah. And then there, they will also give you a 30-day bus pass if you're job searching. But that's only if you chose that option.
So with rehab again, like, I can't leave?
So rehab, there's outpatient rehab and there's inpatient. Outpatient, you can leave. Inpatient, you can't leave. So it's up to you. There's different options for you. Because right now, I see your barriers are the drugs and how you make your money. And there's different ways to make money. You don't have to do it that way.
Okay. Well, I do want to make money a different way, so I think that I'm willing to give this place a shot.
Okay.
And, like, with rehab, you said I'd have my own room?
Yes.
And, like, food and stuff, inpatient?
Yes. But then not all places. So I'm just going to clear that up. Not all places. Only some places you'll have your own room. Other places you have to share with, like, a couple of people. So it's kind of up to you to choose. You get to choose where you want to go and what your insurance covers.
Well, I guess it's better than where I'm at right now. So, okay. Can we get started on, like, the food stamps and access?
Sure. So, can you just go, okay, this is the case plan. So, like I said, we're going to start with your food stamps, access, and after that, we'll figure out if you want to go to rehab or not. I'm going to provide you a bus pass to get there. And then we'll meet every 2 weeks. Is that okay? Sounds good?
Yeah.
Perfect. Okay, can you go ahead and sign your case plan, just stating everything that we discussed?
Yeah.
Thank you. Well, it was nice meeting you.
You too.
I will see you in 2 weeks. I'm also going to go ahead and give you a referral to CBI, okay?
Okay.
Okay. Well, nice meeting you.
Nice to meet you too.